guys, so we did fatigue in nursing as our topic, and as nurses we put in long strenuous hours caring for vulnerable and critically ill patients, and there are many measures to keep the patient safety in check, but few measures to maintain the safety by preventing fatigue in nurses. So nurses are on the front line of caring for patients, so we must be on our game at all times, but we also have to take care of ourselves. Fatigue can contribute to changes in nursing judgment and increase the risk of medical errors. And if fatigue is continual, it can lead to compassion fatigue or burnout. Many factors contribute to fatigue, including long shifts, shortage of staff, or patient overload, and emotionally tolling experiences. So why is this an issue, and what are the studies to support this issue? A study in 2004 conducted by the Journal of Health Affairs looked at 393 nurses who worked over more than 5,300 shifts and found that those who worked shifts 12 and a half hours or longer were 3 times more likely than others to make an error in patient care. Also, working overtime increased the odds of making at least one error, regardless of how long the shift was originally scheduled for. All nurses reported working longer than scheduled at least once, and the majority reported working longer than scheduled 10 times or more in a 28-day period. There are no state or federal regulations restricting the number of hours a nurse may voluntarily work in a 24-hour or 7-day period. State legislatures in 19 states have considered bans on mandatory overtime for nurses. However, bills prohibiting mandatory overtime have only passed in California, Maine, New Jersey, and Oregon. A 2014 study in the American Journal of Critical Care found that nurses who were fatigued, lost sleep, or couldn't recover between shifts were much more likely to regret a medical decision they had made during that shift. Studies consistently link fatigue to errors, increased risk-taking, decline in short-term memories, and a reduced ability to learn, with researchers likening the performance of someone who is awake for at least 17 hours to that of a drunk person. The American Hospital Association says policies are designed by each hospital to prevent nurse fatigue by limiting the number of shifts and hours in work weeks. However, federal and state legislature are pushing for more regulations on patient load and providing support for nurses, but these policies related to these issues are very slim. We looked at policies under Providence addressing practices to prevent fatigue in nurses on the website, but there were no specific policies directly for nurses. We did find several policies, procedures, and standards of practice to protect physicians or residents from fatigue. And one of these is the resident duty hours policy, which states that safety and welfare of patients is paramount, and the residency program cannot apply for exceptions to allow residents to work over duty hours. However, this does not take into consideration that nurses are the ones caring for the patient and are susceptible to making medical errors as well. Residents must log hours and report them via a form that monitors compliance with the policies, and faculty must supervise all patient care and supervise residents at all times and recognize signs of fatigue. The American Nurses Association Professional Panel on Nurse Fatigue is pushing for more policies for nurses. And they emphasize that nurses and employers have shared responsibilities of preventing nurse fatigue, and the goal is to work together to build an environment that keeps patients safe and nurses healthy. Fatigue not only increases risk of making errors, but also may cause harm by drowsy driving, and repeatedly working long hours without adequate rest can affect nurses' long-term health, including a risk for diabetes, musculoskeletal problems, and obesity. The ANA policies calls for nurses to work no more than 12 hours a day and no more than 40 hours in 7 days, and at least 10 consecutive hours a day of protected time off so nurses can get 7 to 9 hours of sleep. Researchers have shown that working more than 12 hours a day or more than 40 hours a week poses a greater risk to nurses, patients, and to society, such as car accidents caused by fatigue. Night shift nurse should also be able to nap or rest in the middle of their shift so they're not fighting their circadian rhythms. The ANA are working on enacting a policy that allows nurses to reject an assignment if they are fatigued and to prevent the use of mandatory overtime as a staffing solution. So there are policies in place by the ANA, but ultimately hospitals form their standards of procedures, and there needs to be more of a push to protect nurses for fatigue, which in turn will improve patient safety.
Action.
Some solutions for combating fatigue during a nursing shift include promoting frequent uninterrupted breaks, eliminating the use of mandatory overtime, limiting work weeks to 40 hours, that's a maximum number of hours per week, and work shifts that do not exceed 12 hours, enacting a policy that allows a nurse to accept or reject a work assignment based on if they feel that their fatigue is a risk for patient safety. And then that another solution is outside of the shift, nurses should take care of themselves by exercising and resting well and just taking care of their body, because nurses with increased body fat had a higher level of reported fatigue during their shift. So taking care of yourself is important. Pros for these solutions are that they increase patient safety, they decrease nurse burnout, and they also increase the ability to be compassionate, which results in a better nurse-patient relationship. Some cons are there's a decrease in ability to get paid overtime, there's a decrease in the amount of staff availability due to the increased likelihood of understaffing in the hospital, and there's a decrease in the length of a shift that can result in a nurse having to work more days in the week, like if you worked 3 12s versus 5 8s. Yeah. The final recommendation would be to mandate policies that do not allow nurses to have consecutive shifts, that those shifts do not have enough time in between, as well as add or increase the number of breaks towards the end of a nurse's shift. So get Our final recommendation is that there's policies that are in place that do not allow nurses to have consecutive shifts with not enough time between each shift to recover, as well as add an increase in the number of breaks towards the end of a nurse's shift. These recommendations will allow adequate time for rest and recovery, take care of yourself in between each shift, and decrease the risk for a mistake due to fatigue at the end of each shift. And then some knowledge gaps that are present are knowing when you're fatigued and need to rest, as nurses tend to push themselves, understanding the impact of time it takes to get to work, like the commute. More studies need to come out showing the link between fatigue and patient safety, as well as long-term effects of fatigue on the nurse. Also, there are more studies to explore 8-hour shifts in comparison to 12-hour shifts. Those are needed. Both nurses and hospital boards need to take responsibility. Nurses need to be educated in how to identify fatigue and report this, and the boards need to be willing to be flexible with nurses and identify strategies to prevent fatigue-inducing environments such as short staff and overtime. Also, there's, even with policies that promote mandatory overtime, there's no way to regulate voluntary overtime. Thus, nurses are pressured into doing voluntary overtime. We have all seen this in the hospital, at clinical, where nurses are almost peer pressured into doing overtime by the pay incentive and like guilt trip by the charge nurse or others like that.
So possible related problems to nursing fatigue can be chronic understaffing, forcing nurses to work long shifts and overtime, stress and work-related mental health issues, which can cause lack of sleep in our healthcare professionals, nursing burnout emotionally and physically, and neglect of self-care by our nurses. Patients can be affected by this nursing fatigue, and research indicates that risks of making an error were significantly increased when work shifts exceeded 12 hours, when nurses were working overtime, or when nurses worked more than 40 hours in a shift or in a week. And these errors, such as med errors, charting errors, and decreased nurse-patient interaction, can cost the hospital even more money in terms of increasing the likelihood of sentinel events and having to pay for these med errors. Nurses on the floor can be negatively affected in many ways by this fatigue. Fatigue can cause a decreased capacity for patients and collaborative teamwork across a unit, and decreased unity among the floor can represent a negative experience for these patients and affect their perception of the whole hospital. So nursing fatigue can affect more than. To evaluate if these solutions are effective, we can look at patient satisfaction ratings. We can analyze the frequency of med errors and sentinel events, and we can analyze the amount that these events cost the hospital as well. We can inspect individual nursing schedules and analyze if they are conducive to adequate rest periods. And lastly, we can ask nurses themselves how they're feeling personally and send out job satisfaction surveys.
Here we have a nurse who just worked a 12-hour shift at the hospital. However, due to decreased staffing, she's having to work another shift. She's taking care of a patient and giving her morphine injection for pain.
Okay, so I have your morphine here for you, Casey. It's just gonna help with your pain.
Okay.
Do you have any questions?
No.
So it looks like she didn't do the 5 rights and 3 checks.
All right, there you go.
Thank you.
And I'll be in a few minutes to check on you.
Okay. Kind of feeling a little weird. Like it's hard to breathe.
No, keep going.
It's hard to breathe.
Okay, you are? Okay. I'm so sorry, you guys.
5 minutes later.
Casey? Oh shoot, respiratory depression. Call a code, get Narcan. I gave 5 times the right dose. Oh